Dr. Eva Natukunda from Joint Clinical Research Center, Uganda, reporting safety, pharmacokinetics, and efficacy of low-dose ECF TAF in virologically suppressed children over 2 years of age living with HIV.
I'm Dr. Eva Natukunda from Uganda. On behalf of the research team, I present the safety, pharmacokinetics, and efficacy of low-dose ECF TAF in biologically suppressed children aged 2 years and above living with HIV. I report no conflict of interest. Young children, especially those weighing less than 25 kilograms living with HIV, have few ARV options. There is no single tablet regimen used or approved for this population in the US or European Union. TAF has been shown to have a safe bone and renal profile in adults, older children, and adolescents in association with low plasma tenofovir exposures compared to tenofovir disoproxil. The fixed-dose combination tablet of elvitegravir, cobicistan, emtricitabine, and TAF is a once-daily complete ARV regimen recommended as an initial regimen in the US in adults, adolescents, and children at least 6 years of age and weighing at least 25 kilograms. This single-tablet regimen has now been co-formulated into a low-dose tablet for children who are at least 2 years of age and weighing between 14 and 25 kilograms. We report today the first PK, safety, and efficacy data of the low-dose tablet of ECF TAF in children 2 years and above living with HIV. This is a single-arm open-label study with an age-staggered design. The primary endpoints of this study are to determine the plasma PK of elvitegravir and TAF and evaluate the safety and tolerability of ECF TAF through 24 weeks of treatment. The primary results from cohort 3 are the focus of the present analysis. Key inclusion criteria for cohort 3 included a viral load of less than 50 copies for at least 6 months, CD4 count of at least 400 cells per ml, and eGFR of at least 90. 27 participants were enrolled and all underwent intensive PK testing at week 2. The primary endpoint of this cohort was reached at week 24 and secondary endpoints at week 48. After week 48, participants are offered continued participation in the extension phase of the study. Of the 35 patients screened, 27 were enrolled and all have reached at least 40 weeks. At baseline, the median age was 6 years with a lower age of 3 years. The median weight was 19.3 kilograms and 63% were female. Almost half were enrolled in South Africa, with the remaining half enrolled in Thailand, Uganda, USA, and Zimbabwe. 89% of participants were Black. All were biologically suppressed at study entry, had a median CD4 percentage of 37 and a median CD4 count of 1,600, and a good renal function. Most were infected through vertical transmission. Most baseline ARV regimens prior to study drug were NNRTIs and 2 NRTIs. The PK parameter of area under the curve for elvitegravir and TAF was the primary endpoint in the study. The geometric mean AUC of EBG and TAF in cohort 3 were compared to adult AUC values and were shown to be modestly higher in children than adults. The elvitegravir TAF concentration was slightly lower in children than adults, but was still ninefold above the inhibitory concentration for wild-type virus. Exposures of EVG and TAF are within the range of historical data in adults, adolescents, and children that have been shown to be both safe and efficacious. Additionally, exposures of cobicistan, FTC, and tenofovir also remain within range of historical data. There were adverse events of any grade reported in 74% of participants, but no grade 3 or 4 adverse events, no adverse events leading to drug discontinuation, and no deaths. The most common adverse event were respiratory tract infections, cough, decreased appetite, and vomiting. 4 participants had adverse events considered related to study drug, consisting of diarrhea, vomiting, asthenia, and decreased appetite. The one unrelated serious adverse event was pneumonia. 1 participant had a grade 3 laboratory abnormality of decreased platelets. eGFR remained stable over 48-week period. Bone mineral density analysis showed that participants mineralized bone according to their reference population. Additionally, no participants had a 4% or more decline in spine or total body less head BMD by week 48. Over 48 weeks, body weight improved while fewer gains were observed, with height consistent with what has been reported in the literature for children living with HIV on stable regimens. Virologic efficacy by FDA snapshot analysis at week 48 showed that 89% of subjects in cohort 3 were below the threshold of 50 copies per year. Due to COVID-19 restrictions, data was missing in the analysis window for 7 subjects. No subject met the criteria for resistance testing. The CD4 count showed an initial decline at week 2 that was not reflected in the percentage. Both remained stable to 48 weeks. Acceptability and palatability were also assessed by questionnaire requesting information as to whether the tablet was broken in half to swallow, which was allowed by the study, and how easily it was swallowed, and how acceptable shape, size, and taste of the tablet were for participants. Mean adherence assessed by pill count was high at 97%. Swallowability, a component of acceptability, and palatability were assessed at baseline and at week 4 and 24. The number of children who needed to split the tablet decreased from 4 at baseline to 1 at week 24. Ease of swallowing was high in this population, in which the youngest age was 3 years, and improved over the 24-week duration, and taste was also mainly rated as good or super good throughout the 24 weeks. In conclusion, in virologically suppressed children, ECF TAF low dose single tablet treatment was well tolerated. All AEs were mild to moderate. There were no adverse events that led to discontinuation. ECF TAF demonstrated excellent adherence and maintained virologic suppression. The low dose tablet had a high level of acceptability. Exposures of albuterol and TAF were consistent with ranges of exposures observed in adults in phase 3 trials of ECF TAF. Efficacy and safety were consistent with results from phase 3 trials, which showed high proportions of viral suppression, no resistance, and good tolerability. These data support further pediatric studies of ECF TAF, which may be an important integrase inhibitor option for HIV-infected young children aged 2 years and above and able to swallow a tablet. Thank you very much. This study was funded by Gilead Sciences.